Welcome everyone, and thank you for joining us today for the meeting of the New York City Health and Hospitals Finance Committee. Today's meeting is officially called to order. First, I would like to propose a motion to adopt the minutes of the Finance Committee meeting held on March 15th, 2021. I'll poll each member for their vote. Jose Pagan?
Yes.
Sally Hernandez-Pinheiro?
Yes.
Danielski Peña-Mora?
Yes.
And Barbara Lowe?
Yes.
Great. So the minutes are adopted. Next on the agenda, we'll have a financial update from John Olber, the Chief Financial Officer, and I think members of his team, as well as Matt Siegler, Senior Vice President of Managed Care. John?
Rita, do you
Yes.
want us to hold questions till the end?
Yeah, that would be great, Sally. If we could hold questions to the end, I think that would be helpful. Got a lot of stuff to get through.
Good morning. It's great to see
Good morning.
everybody. Yep, thank you for your time. So this is our report through the third quarter, taking us to the end of March. I think we did very well. I would, say that we're continuing to be stable. Our closing cash balance was $350 million through March. Against the budget, we finished $65 million ahead of the budget, or 1%. We slipped a little bit there from the previous quarter, and I think the reason for that primarily is we've kind of reached this inflection point where our COVID spending is now surpassed the amount that we got from PRF, right? As you recall, we got, very generously $1.2 billion in PRF funds and another $200,000 in FEMA dollars. But our expenditures to battle against COVID has now surpassed that, and we're waiting for assistance from FEMA. But again, I think when you take that into account, our margins would otherwise be pretty strong. I'll also note here that, and we'll go into the details, but for accounting purposes, we've taken the T2 revenue out of the budget picture. And go back. Yeah. We've taken that out of the budget picture for now. It's primarily accounting. We'll go through some of the details there. Patient care receipts, doing extremely well, $331 million higher quarter to quarter, year to year. That's not against the budget, but that's actual performance. You recall last year we finished very well, and we're up over $500 million. I think we're on track, for that same level of performance for this year. Volumes are coming back. I think we have a slide in here, one that we like. I think outpatient volume is actually 4% down, looking compared to pre-COVID. ED, I think, is down still 30%, but where the volume is down is really in the less intensive, patients. But again, ED coming back a little bit. And then, same with the inpatient is down, but length of stay, it continues to still be longer because of the intensity of the patients that we serve. So overall, we're starting to see the system, return back. Matt will go through the strategic financial initiatives. I think, despite COVID, we've managed to maintain our focus, and we're generating $431 million and have a line of sight of over $530 million, which I think is really exceptional. We'll go through, some of the details there. Staffing investments still on our mind. We've developed an inpatient nursing model, and we've added over 900, nurses there. We're shifting our focus to the ED. We now have an ED model that's almost, near complete. We're just kind of doing this final vetting on that. Hopefully have that in place at the beginning of FY22. EVS, environmental services, we have a model, prepared there, and hope to build that into the 22 budget. And Margie keeps working on rev cycle, and we're making progress there. So I think, all good. The next is we position ourselves for closeout, really for the end of the year, right? You really have to start that process now, or maybe even last week. There's a lot of pieces of the puzzle still not yet on the board that we're going to press to get on the board. You've heard us talk about the dish glitch fix. We should have named it something else, but there's a lot of money there owed to us, by the feds, and we're getting good progress reports that it will come to us soon, but then we have to execute that transaction with the city and the state. The other is, as I mentioned, you hear us talk about FEMA. We really need to kind of step it up with FEMA. There's, I think, good productive conversation, but we need to get make a little bit more headway, and we plan to do that, over the next 6 weeks. And then there's, just the bolus of work that we have ongoing with the state as it relates to, some of those important transactions that were part of the MRT. We had conversations with them this morning. We're getting very close in terms of releasing those dollars to the plan. But I would say the next 6 weeks, we're going to have to press hard here on all fronts. And I remain confident we have pathways to each. It's just going to require some assistance, from our partners. I'll turn it now over to James. James, are you there?
Yes, I'm here, John. So just to go into a little bit more detail on the cash position and some of the things John noted. So Hetty mentioned earlier, we ended March with about $350 million or 16 days, which is, about the lowest we want to be on an ending month basis, and we like to stay above $300 million. The $350 million that we had did include $109 million in DISH that we had received out of the $511 million that you've heard us talk about over the last few months. April, we're still working on closing out exactly, but it'll be around $300 million or about 13 days. The reason that got a little bit low is that the remainder of the DISH payments, the remaining $400 million, we actually, I'm happy to announce we received this morning from the state. So we thank the state for working through that. So that was a huge help, but it did mean that instead of getting it in April as expected, we got it, second week of May. That's really great. So that the total $511 million that we've been talking about for a few months now has been received. This certainly, as always, with the size of the DISH payments, does help carry us through for a while. So we're projected to end May with about $550 million, which is quite strong, and really gives us, a good path forward towards the end of the fiscal year. Even with that, though, of course, we're always looking for additional funds, as John mentioned. We have the DISH glitch fix, which we might get into in a little bit more detail. We also have our second FEMA package, so we're working on trying to get those funds secured before the end of June. Given the timeline that these things take, it really is working on them now and getting anything finalized that we can, so that as payment timelines and funds flow happen, they can actually arrive by June. So we'll continue to work that. We're continuing to work kind of any cash options that we have, but with the DISH funds, we do feel like we're in a much stronger position, which is really good news. Anything else to add, John?
No, I think that's good. Thank you.
Hi, good morning, everyone. This is Micheline. In this slide, we're digging a little deeper to the highlight that John spoke to earlier, is that even with service volume being lower, our cash receipts in Q3, when we compare actuals to actuals this fiscal year versus the same period last year, are actually 11%, still beating last year by 11% at this point. And on the cash side, the cash variance that you see here is made up primarily of our revenue cycle and other initiatives, the outcome of that and the progress that we've made there. There's also an impact here of the CMI as well as Medicaid changes. And lastly, the enhanced reimbursement for COVID compared to prior year. For the year-to-year cash variance, we start to see the COVID impact starting to appear in last year's Q3. So you start seeing that percent narrowing a little bit. Again, from at that point, we're comparing where we were at the end of the quarter last year, where our surge started, versus this year. So again, that contributes to some of that narrowing of the percent cash variance. But still, dollars wise, you'll see later in the next couple of slides, we're going to be talking about the actual revenue dollars, which are about $330 million in patient care revenue, and that 11% distribution of that is shown here, but we will talk about the actual dollars in the next slides. We also have Nina with us. She could take a little bit through the volume changes that you see in blue on the left side. Nina?
Hi, Micheline. Hi, everyone. So I think John really covered this in the Q3 highlights. So outpatient visit volume has kind of reached close to the prior year volume for the fiscal year to date. ED visits and inpatient discharges those trends are sort of continuing to persist. And as Micheline mentioned, with the cash variance, the end of Q3 2020 was when we started to see the initial surge in COVID cases. And so I think, we'll see that impact a little bit more when comparing Q4 on the volume side.
Thank you. Next slide. Arlinda?
And did you want to
James?
start going through this one?
Yeah, no, I think I covered a lot of this. I mean, it's really, when I look at this slide, it really reflects all the external risks, that we've had to grapple with. And it tells me that, there's a lot of people out there that are trying to help health and hospitals at really every level of government, and we're grateful for that. I would say that the ones, the state budget, we had kind of shared with you that the executive budget had tremendous number of cuts in there, and again, that was all before the subsequent relief from Congress. Those have all been restored, and actually my view of the state budget is that there's probably a benefit there within it for us. There's pretty significant increases for the essential plan program that we will be taking advantage of. There's a quality pool program in the essential plan. We do well in that area. So I think overall state budget turned out pretty good for us. City budget, Mayor had in the initial budget $325 million in additional capital, and in the most recent iteration of the budget added another, I think, $348 million in capital. So we're very grateful for that. We have significant capital needs, as you know. Then again, it's really all lining up around the FEMA reimbursement, and we're going to focus on that very seriously over the next 6 weeks. Next slide, please. Micheline, did you want to do this one, or
Yep.
Salima?
Sure. So on this slide, we are looking at two things: the performance, as well as our performance against last year's actuals. So on the left side is where you see this 5 million John mentioned at the opening, of where we're doing better than budget, and that's basically when you add up the blue bar, and which is the receipts, and the green bar, which is the disbursements variances. So the 447 minus the 382. So this is where you get it 65 million better. On the patient care side, against budget, that is basically made up of the 408 is made up of our inpatient and also our risk performance, which includes better performance than anticipated, as well as the catch-up Metro Plus payments that we have received. On the green bar against budget on the left, this is where you see our COVID expenditures that are yet, or I should say disbursements, because it's a cash aspect, and so the timing is important here. So we have about $368 million, as John mentioned before, in terms of the timing of us receiving the dollars that we have not been able to offset yet. So hoping to receive the dollars to offset that eventually from a cash perspective. On the right side, the two bars here, you see the year to year. So we talked a little bit earlier about the 11% year to year cash variance and beating our actuals against last year. That you see in the 646 patient care. In here, you have the 334 million about of inpatient, which is again what you saw earlier in the 11% change, or doing better. And then the other piece of it is on the risk side, with again better performance and catch-up dollars, particularly on the Metro Plus side of the world. The expenditures, for the expenditures on the right side, you see the 378 negative is mainly, or that means really 368 higher, made up mainly of 368 higher expenditures this year against last year, again, due to COVID, and that has not been offset yet from a timing perspective. So that's the main driver here. Okay, so from here we can go to the next slide. So the next slide is just a bit of a closer look and a different view of the revenue. So this is all, this is the actual numbers in terms of not variances like we just went through. So these are the actual revenue numbers that you see for fiscal 20, for fiscal 21, and then on the right, you see the FY21 budget bar. So again, a different view of the same dollars that we looked at before. The FY21 patient care revenue being 646 million higher than 20 actuals. We see that on the left two bars, and we already talked about the components of that between risk and inpatient. So again, just really a different view of that and more for reference.
Hi, good morning, everyone. This is Tasha Philogene. I'm presenting on our progress of the strategic initiatives through Q3. And at a very high level, our initiatives continue to perform well with actuals of $431 million, as John highlighted earlier. This is compared to our risk-adjusted target, which aligns with our financial plan target for FY21. We're also tracking internally to higher targets and are projected to see actuals come in very close to that target. So that's good news. Compared to our Q2, we've updated the program status to on track for our growth and service line improvements, system efficiencies, and VBP initiatives. We continue to see great improvements in our revenue cycle and managed care initiatives, including the managed care high-cost outliers, enrolling uninsured patients into coverage, and one-time settlements. And in our strong performing growth initiatives with 340B CPAS pharmacy, for example, system efficiencies, particularly around the EITS initiatives and our VBP with our HARP or HARP membership conversions. The line of sight has decreased slightly from our previous quarter by approximately $2.8 million, which is a result of adjustments made for COVID testing revenue. And at this point, we're evaluating recurring and new opportunities for revenue generating cost savings initiatives as we learn more about the impact of COVID. And we remain focused on our top priorities for performance improvement. So in the upcoming slides, we'll share our strategy for the fiscal year 22 budget season.
Great. Thanks very much, everyone. Good to be with you again. Just a couple of slides on how we are approaching the fiscal year 22 budgets for central office, each of the facilities, and our key service lines. Last year, just for context, the budget was clearly developed right as we were coming out of the spring COVID surge. The Trump administration was still in place, and there was significant uncertainty about the city, state, and federal policy direction and budget picture. We implemented a budget that tried to limit a fair amount of our risks, preserve our flexibility, and really have us execute on some basics and build some core infrastructure so that we could be flexible regardless of what the policy environment presented. We were very successful, thankfully, and I think as we look to the 22 budget, building off of our strategic pillars, our foundation of social and racial equity, we are in a good position with more clarity in the policy environment to build upon our initiatives and restart some initiatives that were delayed due to COVID. So supporting the overall city's recovery from COVID and advancing our mission, our vision and values is our goal for the year. And on the next slide, we have some detail on some of the things we're considering and building into budgets at the various levels around the system. The first column are some of the strategic focus areas that we discussed with this committee a year ago. And then we talk about some of the key results and how that's translating into proposed FY22 initiatives. So, one of the key things we started was taking advantage of a slowdown in our operating rooms during the COVID surge to redesign all of our processes and get ourselves in a better position to drive revenue through that key area. Dr. Allen, Dr. Parikh, Chris Roker, and many members of the team have been very successful at that. Our overall first case on-time start has gone from 64% to 90%. Our cases are up and our revenue is up. So it's a good example of strong multidisciplinary collaboration and performance improvement and really executing on the basics to be successful. So we're going to continue some of that same effort, certainly in the operating rooms, but also with key outpatient specialties and radiology around the system in FY22. Next row down, succeeding in value-based payment. Sorry, I'm still back on this. Yeah. Succeeding in value-based payment, always a focus of ours, but we put in place last year some key infrastructure and new workflows to help grow our attributed membership as membership in Medicaid in particular grew and disenrollments ceased, and helping people get in the right specialized health plan for them. So we had great success there while doubling down on our efforts in a very challenging year to earn money in our managed care quality programs. So I think all of those efforts were successful, some more so than others, but we're going to have a very more granular focus on growing our primary care panels this next year. Retaining the membership growth we've had is a big priority of ours and Metro Plus's. There's a lot of work in place to do that and will be a key effort over the next year. And then to take some of these new efforts like HARP enrollment and HIV SNP enrollment to make that more standard work and continue to grow them in the coming years. Revenue cycle and managed care were successful this year, and I think the work to put in just two words, really, it's going to be focusing and refining the work. We've got a strong base to build upon, but picking some key persistent areas of denials from health plans and other payers will be a key thing for those two teams working together in the next year. Ambulatory care, a very uncertain picture last year, given the massive changes in volume and the rapid shift to telehealth. Been incredibly successful in doing over 1 million telehealth visits, getting 65% of our patient base on MyChart, while saving the city with testing and vaccines and really amazing work. So building on that and getting just continued focus on optimizing that mix of in-person versus video versus phone, using the incredible success of MyChart and our work around the city to grow patient volume and to continue to expand our virtual express care model. I think will be other key initiatives for the year ahead. And then I think our catch-all of just operational improvement and focus, our post-acute service line performed very well last year, but we'll continue to work with them on their margin improvement. IT has been very efficient, hit their savings target, as have pharmacy and lab. And I think we can build on those in addition to some work with community care and our supply chain team, who sees some new opportunities in the year ahead. And then, as John mentioned, the Medicaid redesign team proposals from the state and other key transactions we can do with them will be a priority for the year ahead. So this is all part of our system financial plan, which is reflected in the mayor's executive budget. And really, just to underscore our work in managed care and finances is about generating the resources that our clinicians need to do the work that we're all here to do, advancing the mission. So we are proud to do that, and hopefully this will be another productive year for health and hospitals. And I think Micheline or Krista can take you through the timeline of how the facility budgets work and where we are. That's the next slide.
Okay, thank you, Matt. So on the next slide, I'm sorry, I don't know if it's updating on mine or it's frozen. Are we on the next slide to see it?
We're getting there. We're close.
Oh,
Not yet.
I wasn't sure. My whole access has been messed up today with WebEx, so I can't tell if it's on my side or.
It's the next slide.
It's the, which one, what is the one?
Looks like that.
That one is the one that's on. Oh.
FY22.
Yeah.
I have it here.
Okay.
It's just not popping up there. Micheline, can you go ahead? We're having a delay. The technology today is not at its optimum.
I know.
Sorry.
I totally
It's
hear
here,
you.
but it's
Not a
not
problem.
here.
Okay, so basically the next slide is
Call the
showing
clerk to see if he
the
can do
budget
this.
planning framework through which that strategy is being implemented that Matt just went through. Right now, the budget planning framework is a collaboration between the growth team, finance, hospital execs, and service line leadership. And we have three phases of that budget. At this point, we have completed the first phase, basically starting. It's good actually that we're looking at this slide while we're talking about this to tie the two. So the phase one is actually where we are looking at the left side of this chart that Matt went through, where we are looking at FY21. What is the impact
See
of
that
all the
window.
plans
Give me the
and
panel.
strategic initiatives
Sorry,
or implement?
Felicia, there's noise coming through from the boardroom. It's cutting out Micheline a little bit. Is it? Can you mute maybe in the room? Well,
Okay. I'm sorry, Frida, it's the network. We having problems. It's going in and out.
okay.
IT
Okay.
is currently working on it.
Okay, sorry. Go ahead, Micheline.
Okay, that's okay. So for phase one of the budget, which just actually ended in April, what we have worked on is looking at the fiscal 22 financial impact of all the approved plans that went through in fiscal 21 and approved both business plans that have been submitted by the facilities, as well as strategic growth plans that span system-wide, as well as ones that have executive leaders. And so all of these at this point have been folded into the budgets at the facility level. And right now what we are doing is two things: moving into phase two as well as phase three in parallel. Phase two is basically where we are taking any external funding impact, whether the state or the city, through our executive financial plan that is in the works right now, and applying that to, or pushing it down at the facility level to look at the impact for the facility, for each facility with their net margins, looking at the revenues against expense. Our goal there obviously always is to at minimum break even or be or have a positive net margin. And then this week, actually, we are shifting into phase three and the final phase of our budget planning for the fiscal year. And that is going to Matt's right side of the chart, the rightmost column, which is what are we doing new at each facility level? Which areas are we going to grow and focus on for fiscal 22? And starting to discuss those initiatives, and the facilities will come back with their proposals for the new initiatives that we will apply to phase three, looking at the impact of those initiatives on the net margin, both on the revenue expense and doing better at the bottom line. Then once that is completed and there is a sign off, then we release our formal budget. And that's the end of my slide.
So I think the network might be frozen, but I believe the next slide is on federal relief, which I can run through briefly. And I'll try and talk to the slide if folks can't see it. But essentially, to walk through our expenses first, through March on our sort of total overall COVID expenses, we were at over $1.7 billion. That's against our current estimated commitments of at least $2 billion that we've made towards fighting COVID, and those are in our major categories that we've discussed previously of temporary staffing, personal protective equipment, various equipment and infrastructure updates, and then supplies and pharmaceuticals and other miscellaneous things like that. So over 1.7 billion of at least a $2 billion spend at this point. In terms of what we've received from the PRF funds, as John noted earlier, we've received just under $1.2 billion thus far. That was in the various pools that we've received previously, the high impact pool, there was the safety net pool, and then the general allocation. In addition to that, just under $1.2 billion, we've also received at this point $266 million in FEMA reimbursement. That is the entire advance of sort of the first package that we had submitted back last March. So we had $650 million that we submitted to FEMA. They had conceptually approved $532 million, which allowed us to draw down 50% of that, half of that at the full 100% federal share. The first $200 million we'd received back in October, and then the remainder was advanced by the city to us while anticipating the federal reimbursement so that we could have the cash, and when the federal funds do flow, they will just remain with the city. As we've talked about a few times now, and I think you'll continue to hear us talking about it because of how important it is, our temporary staffing package related to FEMA, that next package is with them now. It repurposes, in essence, the remainder of the first package, since we had only gotten the 50% advance, and is now being focused in the various categories, such as temporary staffing, PPE, with temporary staffing being the one that's in front of them now. So it's sort of, it's taking that first package and presenting it for what's remaining. So we're working very aggressively to try and get those funds in, and we'll continue to do so. And then in terms of any other funds, there are still some unallocated CARES Act funds. We don't know exactly what to anticipate, but we of course continue to want to advocate for any funds available that they flow to us and other Medicaid and safety net hospitals. So that's in essence the slide, John, unless you have anything to add.
No, I think that's great. Thank you.
That's good. Thank you.
Okay, our last slide is test and trace financial update. So I'll just speak to kind of what the slide shows. We've paid out about $750 million through March for T2 work of about $1.5 billion of estimated expenses over the same time period. We continue to receive adequate and regular drawdowns from OMB to cover these expenses. As far as funding sources, go, we've received some additional funding since we last spoke, including $270 million of additional ELC funds on top of the 580 that we received last year. We also have $250 million of ELC funds for school testing. Of course, we also expect 100% reimbursement for our FEMA eligible expenses related to testing and vaccine. And then OMB is also expecting additional funding from the American Rescue Plan for T2 work, though we don't know yet how much or what the timing will be.
Great.
Thanks,
John,
Frida.
that
Yep, I think that's what we had for today, yes.
That's terrific. So I'm going to open it up to the committee for questions. I just first want to thank you all for the great job you're doing in managing our very complex situation and keep delivering on our mission and for the whole city through this incredibly challenging time. So I know you mentioned it, John, but I want to emphasize the focus that everyone has had on our strategic initiatives and moving forward through that, even through all of what's been going on. And much of that breathing room maybe that we've had, even as little as it is, has been due to a lot of the work pre-pandemic even, and then the focus on sort of, accelerating on that and pivoting to take advantage of those things. So I really want to commend you and the speed in which you, the team sort of got on top of other opportunities like preparing the FEMA package and all of that. It's just been really important. And then as we can see from Matt's and Sasha's presentation, we're all green on our strategic initiatives. And so that's terrific. And the lessons that we've learned from COVID in 21 and then now preparing for our 22 budget. So the one place that I continue to have a little bit of concern on, of course, is the cash. And, that becomes very tight. And I know there's not a lot we can do here, but want to make sure we keep focused on that. But I'm very, very proud of everyone. It's a lot to be impressed with. So thank you.
Thank you.
Good morning. Hi. Thank you so much for the clarity in this budget report. I just have one particular footnote I would have loved to have seen, and that's on the long-term care impact and the new state rules with admission, which seems to be dwindling resources when a new admission has to be roomed in a single room for a number of days or hours. And I think if there's any clarity you can, or a footnote you can offer today, because that impact can grow pretty quickly. We have multiple long-term care facilities. Hello?
Sure, Ms. Law. I can try to help, and I think we may have to follow up with Maureen and her team after the fact. Overall, the post-acute service line, our post-acute facilities are, I think, extraordinarily well run and well staffed. Right, they are 4- and 5-star facilities with CMS, and so I think throughout an incredibly challenging pandemic, they've performed very, very well, making testing available from their staff, having residents very well protected. They are adapting to the new testing and vaccination offering requirements. It is some additional expense, but that is certainly manageable, and I think will be factored into their budget. I believe you're also asking about the staffing ratios that the state has put forward. I believe we are in compliance with those already, given the solid staffing that our facilities have. It's one of the unique things about a publicly run delivery system. The staff is longer standing, more connected to the facility, higher retention of the staff across our post-acute facilities. So I think that's been a strong thing pushing us through the whole pandemic, and then I think preparing us well for the policy change. But if that doesn't answer your question, I think happy to convene Maureen and her
the
team.
state has asked that anyone with the COVID patients be placed, all new admissions, I understand it to be, to nursing homes have to be sequestered for a period of time, which means that a person's in a room by themselves rather than maybe having, if wherever we have two bedded rooms, that would mean that would be reduced to one for the period for new admissions. I just wondered if there was anything coming up on your radar which might be perceived as a bit of a risk to that budget line.
Not particularly on that piece. I mean, I think it is certainly a risk to patient satisfaction and the overall comfort of our residents at the nursing home. Some of the disruptions that COVID have caused, but I think post-acute's margin is always a challenge, right? Running a post-acute service line when you accept people regardless of ability to pay and payer source, it's not the way private nursing homes operate, but I think they do a great job, and we continue to work with them on any opportunities. But we're very proud of the work they do.
Thank you.
Thank you.
Great. I'll ask. Yep. Sally, go ahead.
I just had two very quick questions and one comment. One of the slides talks about continuing to face cash flow challenges by the end of the fiscal year, and we discussed a submission to FEMA to help address that issue. So I'm curious if there was a projection, assuming the moment we didn't get FEMA relief, on the kind of order of magnitude of the cash flow balance at the end of the fiscal year.
Yeah, we can certainly provide all of that detail. I would say of the 3 or 4 things that I had just that I listed off, really we have to get at least one of them. But I think our plan assumes all of them. So I would, and that's our goal. Our goal is not only to engage FEMA. The time is to do that is now. The dish glitch fix would be a pretty substantial sum of money. Again, that's past Congress, and Linda's been having conversations with CMS. The dollars just need to get appropriated or allocated. And then the third, on the UPL conversion, we're very close. It's been over 13 months of trying to plan this, and we're right there in terms of the rates have been developed. They've been approved by DOB, right, which is very, it's obviously, that's very important. And now it's just really, we have to execute it. But, all of those three things, we are going to try to achieve, right? But we have to at least get one or two of them.
And John, isn't the city always the backstop on cash flow? I mean, this is just a cash flow issue. It's not a It's not a money issue.
Yeah. There's ways for us.
I mean, the city would have to stop us if it really was just an issue of cash flow.
But they have their own concerns too.
I know. I'm just saying that, right, we're not alone.
Yeah.
John, the UPL conversion would be a sort of an ongoing stabilizer for our cash flow. Is that fair?
Yes, that is correct. And it's also a building block when we come and talk to you about, special populations. But it's really a pretty straightforward transaction in our mind. It's just really getting paid our cost as we do on the fee-for-service side, but in the managed care, setting. But it would be an ongoing stabilizer to our revenue stream.
Right. And on test and trace, I have this ongoing, item in my mind. I just want to make sure that the vendors are getting paid very close to when they deliver the service. And there's a statement that H&H paid out about $745 million of 1.5 million of estimated expenses through March. Is that I don't know how that reconciles with my concerns about vendors being paid timely.
Yeah, I'll just make a general statement. I mean, we do not hold on to vendor invoices, right? We're definitely not at that stage. Now, getting the invoice process, right? There's a lot that goes on with that, right? We have to do our due diligence and make sure that we're actually paying for services that we received. But as a matter of fiscal practice, we're not holding on to payments that we owe.
Okay. And the last thing is just a comment. My money's on you guys. You've seen us through the toughest of times when all we saw was kind of revenue bleeding. We weren't sure how we were going to be able to address it. And I just am in awe of the work that you just do. Such incredible work in such rapidly shifting times. So congratulations to all of you.
Well, thank you, Sally. We appreciate that. But there's more work to be done too. So, but we appreciate
more work, John.
Yeah. Yes.
Thanks, Sally. I think Benny had a question.
Thank you, Frida. Again, thank you, John, Matt, and Dr. Katz. Definitely, I want to echo Sally's comment that it's good to be in this type of meetings in which we are talking about the finances in a totally different context that was a couple of years back. So again, thank you for your work. But I want to follow up also on something that Frida said in terms of lessons learned during these very challenging times. From a financial perspective, are there anything that has stricken you in terms of how you are able to manage the finances in a different way than pre-COVID? We all have learned certain things that COVID have pushed us to be extremely creative, extremely resourceful, very adaptable. Is there something that has come up to your mind based on how you have been handling these very challenging years in how to help us look ahead for the future?
Yeah, I mean, I'll start. I'm sure Matt will have his thoughts too. But I will just say back to, as a matter of strategy, I think Frida, talking about the UPL conversion. I mean, one of the things that we're trying to do is, rather than, and you heard me talk about this, rather than making these like lump sum payments that get paid sometimes 1 or 2 years, after the fact, after these calculations are very complicated, have been completed by us and reviewed, right? What we're trying to now do is like build that into the payment stream on an ongoing basis. So when we provide a service, we'll get the value of that UPL rather than doing like lump sums year after year. That stability is priceless for me, right? When you're running a safety net system on such small margin, right? You don't really have the room to wait for these big bolus of payments. Same on dish, right? We're working with the state. We want to have a more predictable dish stream rather than it comes to us in these big lumps after we have to, cajole and ask. And so that's one thing. I will say the other thing that, at least for me, is that for the first time, I think primarily because of Epic and the great work that's being done, we can see into the data. Like we can see the problems, like with denials, and as one example. And you have to like hold yourself back to say, I can't go for it all right now, right? And each facility has their own denial issue. So I have to kind of hold back. And what we've been doing is like, let the facilities see the data, let them decide which one is most important to them, and we'll help them achieve that, right? So I hope I'm answering your question, but I think those are all things that we've learned along the way here.
Thank you.
Yeah, I think the only thing I'd add is just to building on what John said. The one lesson for me is the level of transparency with the facilities on how they're performing financially, right? I think has been very important. If the finances are just a measure of the operations to some degree, right? And so there I think is an older history. This is maybe a little bit unfair, but of the budget being a kind of end of year thing, right? Here's the budget. See you in a year, right? That's an exaggeration, but I'd say before our time that's maybe how it was referred to or thought about. And we've tried to keep it a much more regular, discursive, interactive process of here's your performance this week, this month, next quarter. And I think the more we're discussing that and being open about it, it makes the budget, more a statement of priorities and more a reflection of real operational improvement than just a kind of end of year accounting ledger, which is, I think, what you want to avoid. So that's a big lesson for me.
Thank you so much. I really appreciate it. Very important lessons. Thank you.
Thank you. Jose, did you have any questions?
No, I mean, there's not much left for me to say except to commend the whole team and say thank you. And I'm always impressed with how you manage all the difficulties that always, no matter what, come our way. And just very thankful for that. Thanks.
And Dr. Katz, I'm sorry, I didn't mean to leave you out.
No, all good. Thank you. Thank you.
Great. Well, thank you again, everyone. A lot to be impressed with, and as I said, if there's no other business, I will adjourn the Finance Committee meeting. Thank you.
Thank you, everyone.
Thank you.